Hello everyone, hello Gail, and hello Dipanjana. Today is
Hi.
the live stream number 3 of Unapologetically Uterine, where we talk about everything related to abortion. And this live stream is a very, very special episode because we will be talking in celebration of International Safe Abortion Day. And I know that today is the 22nd and it's not really International Safe Abortion Day yet, but we want to celebrate it a little early with safe to choose and how to use abortion pill. So we are celebrating it about a week early. And also, it's a very special live stream because we have a special guest today. Yeah, let's just get to our special guest today, Devanjana from MSI Reproductive Choices, India. Can you introduce yourself a little bit for us?
Thanks so much, Kat. Hi, everyone. It's a pleasure to be here. I'm Devanshana Chaudhary. I'm from MSI Reproductive Choices, and I work with the India program as the Director, Programs and Partnerships. And extremely excited to be here today to be speaking with you and discuss a lot more about safe abortion access, rights, and choice primarily. Thank you for having me.
Thank you for joining us today. We're very excited to be talking to you because normally we would be talking about abortion context in Cambodia, in Ghana, but then now we also have abortion context in India as well. And I know that a lot of our audience are from India, so it's always good for them to feel seen, to feel heard, and to discuss what's happening in their own country. Now, I before we get into our conversation, I want to have a little reminder that Unapologetically Uterine is a collaboration between Safe to Choose and How to Use Abortion Pill, where we have all this live stream every 2-3 weeks, where we're having all these laid back, casual conversation. So you can join us on Twitch, and you can also watch the live stream back on YouTube as well on Safe to Choose and How to Use Abortion Pill, two separate channels, but you can find the playlist in collaboration. And how to and Safe to Choose is basically an e-health website where you can find all information that you need about safe abortion, about abortion pills, and you can also contact our counselors if you need any support, any information, or any support for abortion. You can always contact us. We have our website, safetochoose.org. We have the website is in multiple languages, so no matter what language you speak, chances are our counselors will speak that language too. And you can also find us on social media. And Gail, how to use?
Hi everyone, it's been a while. I'm glad to be back and I'm very, very excited to have a chat with Angela today. Um, as usual, How to Use is also a digital platform where we share very, very reliable information about how to use the abortion pills before, during, and after. Everything you need to know. Our sources are very, very reliable, so you know that you are getting accurate information. We also have an abortion task force called Ali, who is available on WhatsApp, Facebook, and on our website that you can chat with 24/7. Ali speaks 5 languages and English, Spanish, Hindi, Swahili, and Portuguese. Yes, there's more to come, but Ali is always available for you. We also have a video series in partnership with Doctors Without Borders that helps you know about the process of self-managing your abortion in the comfort of your home. And not to leave anybody out, we also have a course, an e-learning course for medical providers that is in partnership with IPPF. And at the end of the course, if you do take it, and it's important to take it as well, you get a certificate that is approved by FIGO. So that's it for how to use, and you can find us on all social media platforms. How to use abortion clinic.
I would also like to learn a little bit more about MSI India as well. So, in case people don't know MSI India, and I'm sure a lot of people do, but in case people don't know, what does MSI India do?
Sure, thank you so much for the question. I'm very glad to be introducing MSI India over here at this platform.
First of all, we also have the Ali chatbot on our website, and it's an extremely good tool. So thank you, Gail, for that. And we get a lot of requests in Hindi and a lot of requests in English as well, where we have a lot of abortion seekers coming and trying to seek information. So MSI India, in India we are known as Foundation for Reproductive Health Services India, and we provide safe abortion services and contraception services. We work with women, girls, youth, adolescents, and men. A lot of our work goes into creating access journeys and pathways for abortion seekers, especially the ones who are in tier 2 cities, who are not able to access abortion properly or does not have any way to get information. We also have an advocacy wing which is called the Pratigya Campaign for Gender Equality and Safe Abortion. It's 127 plus members and organizations, and we all advocate together to voice for improving access to safe abortion. We work with legal experts, medical professionals, we work with doctors, we work with advocates, activists, and most importantly, abortion seekers. We want to make the abortion narrative in India to be to pivot towards more inclusion. It needs to have more diversity. And we had worked together, and very recently, in 2021, the Abortion Act in India, which is known as the Medical Termination of Pregnancy Act, underwent an amendment. And the entire coalition and many other coalitions, we joined hands and we worked with a host of stakeholders to make that change possible. That change has helped quite a lot, but there a lot remains to be asked for.
Wow, that's amazing. Thank you so much for the explanation, Debanjana. I think it's so important what MSI India and what you are doing, because while our platforms are there for information for us digitally, as part of advocacy, as part of providing information, but we also need on the ground activities. We also need clinics. We also need providers on the ground to complement on top of the activities that we're doing to give more of a well-rounded approach on how to support people and abortion seekers. So I think it's very important, and why I'm so excited to have you here today. I realized that I forgot to introduce our topic for today. So our topic is about supporting solidarity actions and standing up against unresponsive actions. I want to turn this to Gail a little bit. So why exactly are we talking about supporting solidarity actions and standing up against unresponsive actions?
So this is actually one of the themes for this year's International Safe Abortion Day celebration. And even though we are solely based online, even without providing the sort of service we do, ours is basically information, and with Sex to Choose, they also provide counseling services. And a lot of times we realize that when people reach out to us, they are so scared, and if, just because they find it something unresponsive policies. And there are lots of communities like that have really unresponsive policies when it comes to abortion care, abortion service. So this is a topic to try and see how MSI India, especially as you work on ground, try to maneuver your way around communities that have unresponsive policies. And even in dealing with desensitizing your staff, you have to go about providing care for people in these areas. And sometimes these unresponsive policies do not just affect you providing care to the people. It's also brings prejudice and stigma on the part of the people you are providing the service for. So this topic is just to have a conversation about how MSI India navigates providing care in places that have unresponsive policies. Should I continue from here?
Yes, sure.
Okay, okay. So most of our questions are going to be directed at you, Devangela, because you are our guest today and you want to know everything that goes on the day-to-day activities, monthly campaign activities of NSI India and how you do. So I think the first question we have for you today is what does a typical day look like for you working with MSI India?
Yeah, it's exciting to begin with. It's an exciting day. Always, every day is a new day, exciting day. It's very satisfying to be able to work with communities, to be able to raise awareness amongst communities, because one major problem that in India we face about safe abortion is around the legality aspect of abortion, because there are many who still don't know that abortion in India is legal. They do not have an idea on the legality part of it, hence, they do not go to access it. And when things go beyond control, for example, in cases of an unintended pregnancy or in cases of sexual abuse, rape, where the survivor is unable to express herself or himself or themselves, they are not finding the avenue to get a safe abortion. So, our work primarily revolves around a lot of pillars. To share in a bit of a nutshell, our advocacy is mainly at the central level, at the national level, at the subnational level. We work with our partners to create inroads and conversations with the communities. We also work with frontline workers, because frontline workers are actually the ones who are providing the information to the last mile. So it's important that they provide correct, non judgmental, unbiased information. They provide factual information, and they are able to share where are the places an abortion seeker can go and get dignified services. For an abortion seeker, it's very important not just to get the service, but how the abortion seeker got the service. Was it dignified? Was it confidential? Was it up to the mark? How was the behavior of the provider? How was the journey? How was the experience? And whether the abortion seeker was also provided post abortion care, whether the information about post abortion contraceptives was given to that abortion seeker. So that's something that's very important. You must have noticed a change of light in my background, so something popped off. So apologies for that. But yeah, I mean, it's every day is exciting. A typical day would look like in this about in MSI India is going, mobilizing with frontline workers, talking to them about safe abortion and contraceptive choices, trying to talk to the community, create peer champions, peer educators in contraception, uh, and also mostly, sharing the message that abortion is not a contraceptive method, and do not miscommunicate that. Contraception is healthcare. It's very important, apart from the legality aspect, for us to make it extremely vocal and available to every user that abortion is healthcare. And do not think that it is a supplementary service. But however, I would like to make a point. Though we talk about safe abortion, and at least in tier 1 cities, people are slightly more aware than in other cities. What happens is that people do not talk about safe abortion because of the stigma and taboo that is there. And also, unless a crisis happens wherein an abortion seeker has an unintended pregnancy, they do not want to get into the conversation. The stigma and taboo is such in the society that they do not talk to their peers. Their community of safe space is highly narrowed when suddenly an abortion seeker becomes pregnant. So that is something that we are trying to break. And we also work with media persons quite a lot, because we feel that media has a great role to play in this entire narrative, because they influence public opinion to a large extent. So media advocacy is a very important part of our conversation and our work.
Thank you. I actually wanted to stand up and clap when you were saying that abortion is healthcare, because that is so important. I would emphasize it again and again, saying that access to abortion is essential healthcare. So thank you so much for saying that.
Thank you very much. I think for both of us that face to choose and how to use, that's a point we always try to drive across. Because most of the time, anti-choice come with this. They have a lot of ideologies and arguments, but in the end, abortion is healthcare, and it's also a self-care. As the WHO has put out that abortion is self-care, And back to the topic of stigma, India has something in common with Ghana because I'm based in Ghana, and it's alarming the rate at which people do not want to talk about abortion. They don't even want to see anything about abortion. They just don't want to be associated with abortion. I think our last episode I was having a conversation with Kat where we spoke about an incident where somebody directed another person to MSI in Ghana here, and when the abortion was successful, this young lady went back home, told their parents about it, and the parents felt like the person who directed her committed a crime. So this person was arrested, and unfortunately, our protective services are not, they are not the best, sorry to say. So in as much, I don't think this person did anything illegal per se, but she was assaulted and harassed by the police just for speaking up and directing someone to a safe choice when they wanted to have their abortion. So it's crazy. Mm, but back to the question, I think I want to start this with you. What was your first experience with providing abortion care? Whether it was sharing information or what was your first experience? Did you have a medical cause? I mean, what made you choose this path that you are on? So after the Kat and then after Kat, Devanjana, you can answer.
Oh, first experience with abortion service, since I'm not abortion provider. Abortion service, I think my first real experience with abortion service is actually MSI Cambodia. So I was also working for MSI Cambodia for quite a while, and that was when I started to really go deep into abortion care, into in terms of advocacy, in terms of raising awareness, because I was always working on sexual reproductive health, but never really focusing on abortion until I was working for MSI Cambodia. And that was when I learned a lot about not only the process of it, because I was in comms, so I had to work with the medical doctors. I had to write pieces, comms pieces. I had to talk to them a lot for social media content. So that was when I really learned about the abortion side of it. But on top of that, I also learned about the human side of it, because when I did case studies, I would go and interview clients that visited MSI Cambodia clinics. I remember this one time when I went to interview this woman who went to get service at MSI Cambodia clinic, and she was impoverished basically, and she was pregnant. She has, I think, a few children, but then she fell pregnant again and she couldn't afford it. She was living in this room. It wasn't even an apartment, it was a room on the top floor of a flat in the middle of Phnom Penh. And then I visited her in her room. I talked to her a little bit about why she went to get the service. She said that she could not afford to have another child, and she could not even afford the cost of the abortion service at the clinic. She said she had to beg for a waiver, which she did get. A half, actually. She said that the rest of the payment, her husband had to actually go borrow from other people, and it's not even a lot. $20. He had to go borrow $20 from people just to get the abortion. So it shows the gap there. When people cannot afford to have abortion, they would either have to carry the pregnancy to term and even have more financial burden on them, or they would have to find some way to get the financial support in order to get the abortion service, or they would go to back alley abortion service where it can be life threatening for them, which is why I think after hearing that, I think about the gap, and I think about the intersectionality between abortion access and also economic status, because it's not just about the legal part of it. Abortion can be legal, but it can still be inaccessible if we are not taking into account the social economic side of it as well. Yeah. Devanjana?
And in that part, yes, depends.
I completely what Kath said. It resonates with me because my first impression of an abortion service is it dates back to college, and there was in our peer group somebody who needed abortion. And I don't know how she got the access because at that time, I'm talking about long time back, and at that time the stigma was even more. So somehow she got access and she had a very hushed service, but her experience was not good. So for me, it was very important. So I started working on safe abortion when I started working with IPP a few years back, and that was the time when I got to see a service from a very medical angle. I'm also not a provider, so my experiences are that of from that of an outsider who's just enabling this access. But for me, what was surreal was that when a married abortion seeker comes, the kind of treatment a married abortion seeker, a married woman gets, and the kind of treatment an unmarried woman gets is vastly different. And for me, that's horrifying because both of them, they have come for a healthcare service. They have come at a crisis because it has huge implications on her mental health, on her economic situation, on her ambitions, her career prospects, and her livelihood. So I saw vast difference between the kind of behavior that was meted out to each one of them. So a married person got a much better behavior from a host of other people in the medical facility, whereas an unmarried woman, she came with her, just her eyes were visible. For me, it was a stark representation. For me, it was a realization that how stigmatized the service is, that despite it being legal, despite this person being much above 18, she is coming, an educated person in a city is coming with in such disguise. That's the situation, that's the reality, that she's forced to come in such disguise. She's forced to uh, have a very hushed service. So that has been one of my very not good experiences of looking at how two different sets of people, only because one is under the societal marital status, so there she gets that societal umbrella, that protection, only because she is in a status of marriage. The other one doesn't get any kind of protection. For me, it was discriminatory, and through the work, my work with MSI, I have seen the kind of services, the quality of care that is provided in MSI in India and in other MSI countries, the kind of journeys most abortion seekers get, the confidentiality. For India, it is very important for me that whoever comes to seek an abortion in our clinics, it's important that our staff is sensitized. Our staff understands the kind of care that they should be taking in order to provide a service to an abortion seeker. Our providers are sensitized, our counselors are there to make the journey as uh, de-stressing as possible. Of course, the abortion seeker is nervous; she's highly stressed at that moment. But our jobs as MSI is that to iron out the obstacles that are there. So we try to create an environment that if you are at the blue door of MSI, the path inside will be smooth for you. Just come to the blue door, and that's what we aim at, and that's where our work about community mobilization or advocacy goes on.
Perfect. Sounds
Thank you
wonderful.
both.
But before we
Yeah,
move to
yeah.
the next question, I want to hear from you, Gail. You're not off the hook. I want to hear your story as well.
And I'm feeling intimidated right now because you both have these lovely stories about. My first experience is actually with Luna's Digital. That's how to use abortion pill. This is my first experience with service. But before that, I grew up in a very restrictive country, and even in my family. I remember when I got this job, I called my mom to let her know that, okay, I think because I knew my background, I didn't want people to have to call her to tell her, oh, so this is what your daughter is doing now. So I wanted her to hear it from me that this is something I'm doing now. And we were on the call for over an hour. I'm very appreciative of my mom. She's uneducated, but she knows I know what's best for me. And even when she disagrees with what I'm doing, she tries to listen and then make sense. So we were on a call for over an hour. I was telling her, so this is what I'm going to be doing now. So you probably be seeing videos. People will send you my videos because I'm going to be very vocal about this topic that I've set out to be passionate about. And she was referring me to the Bible and how Christianity founds on it. And so that's how I grew up. For a very long time, I was actually anti-Christian. I did not. I thought abortion was wrong. I thought it was murder. I thought you were killing till in college. So I had friends who had to make the choice of having an abortion, and one of them went through so much to be able to get the pills, and they were so expensive for college students. It felt like you were spending all your money for the semester on the pills. That was how difficult it was. And the second person, I was actually with her. We were so scared that she was bleeding a lot, but we did not have anybody to call. And it kind of touched something in me. So I think from that point, I started being more open. I didn't immediately become pro-choice. I started being open to other people's experiences and trying to find ways to make it better for people. So mine actually started out just like hers as sexual health and reproductive education. So I had sort of an event and had a platform. I used to talk about sex, and I was just trying to create a safe space for people to reach out to me and ask me questions. There were times that someone reached out to me and asked me a question about abortion or something, and I don't even know. I go to Google, I look for the information because I wanted to be someone that other people can come to for this sort of information. Then I found how to use abortion film. So this is my first experience. Like I said, my story is not based on anything, but yeah, that's
Actually,
how I started out.
Actually, I think that's a very inspiring story because it shows that we need to be somehow we need to allow people room to grow, right? Because sometimes anti-choice people are not anti-choice because they're malicious, because they are set out to hurt people, because they hate people. It's not always the case. Sometimes it's because they don't know better, because they were always told the wrong information, and they didn't know that there were other sides to the argument, that there are actually reasons why people get an abortion, and start looking at abortion seekers as humans too. I think this goes with everything, with all social issues, not just with abortion. But I think this is why we need to allow people to grow. You know, sometimes they're like that, but maybe if we give them information, maybe if we talk to them, not always the case, I understand. Sometimes it's like talking to a wall, but some people, they actually listen to you, and then they start to ponder, and then maybe they will grow just like how you did, Gail. So that was a very inspiring story. Thank you for sharing.
Honestly. And just to quickly say this and move on to the next question. I made a post yesterday on TikTok talking about how um, the disparity of mental health and abortion, where most anti-choice people have this argument that um, with abortion tickets, people who have had abortion are more likely to be depressed or have anxiety issues just because they chose to have an abortion. So I made a very elaborate video talking about it and giving people suggestions. Then someone came under the comments and asked, have you had an abortion before? And the tone, I mean, just from the tone of the person, I knew that they were asking me that because it felt like if I've not had an abortion before, I I don't have the right to be saying all that I'm saying. And a lot of people were attacking her actually that what does it have to do with what I'm saying? I'm trying to educate people and blah blah. So I just went in and answered her that no, I've not. And she replied that, well, from her was what abortion is wrong. And they say it's murder. So this opened up a conversation between myself and her, and I made her aware. She was actually very receptive, and I stand there for even starting the question because there are lots of anti-choice people who don't even want to start asking the right questions. They just don't want to know. But there are people out there who are also willing to learn, and your upbringing, your socialization plays like a major role in how you feel and what you think about abortion care. And moving on to the next question, back to policies and legalities. Imagine can you tell us the policies around abortion in India? Because for me in Ghana, it's a bit liberal. I think Ghana, our biggest problem is the religious stigma attached to abortion. Besides that, it's a bit liberal, even though there are laws that states that abortion cannot be given to an abortion seeker if it's not on the basis of rape, incest, or it's causing harm to the person who is pregnant. So we would like you to share with us the policies surrounding abortion in India and some of the very unresponsive ones that we usually have to navigate around.
Thank you so much, Gail. It was very inspiring what you said, and also, Kath, your comments after that. We need to have the door of communication, the channel of communication open with the anti choice because you never know, and you need to give people room to grow. Nobody is born with, your perceptions can change over a period of time with exposure to information. So that's lovely that both of you had shared. A bit about the Indian context. So in India, abortion has been legal since 1971, but it's a highly medicalized act. It's from a medical angle. So the abortion law in India came just to reduce the MMR. So abortion in India has not been from a very woman's angle. It hasn't been women centric and it continues to be like that. We got a great amendment in 2021. A lot of things have become easier, like the unmarried clause. I'm sorry, the marriage clause has been removed and now abortion has opened to everybody. The Supreme Court has given many progressive, judgments around safe abortion in India and has gone to the extent of saying that safe abortion is a fundamental right and it should be available to everybody. However, we need to know that there are certain caveats. The gestation period has increased from 20 weeks to 24 weeks currently, but that's only in special cases, and the special cases include minor rape, incest, sexual abuse, and a change of marital status, change of relationships, and a marriage status. So we feel that it should be open to all abortion seekers, the 24-week gestation period. The upper gestation limit for fetal anomalies has been completely removed. But again, there is a caveat in India that there needs to be a medical board. But now you need to understand that, in India, to set up a medical board, if a person is at the subnational level, if there are districts in India which are in the state, in a federal structure. So in a federal state, there are many districts or blocks. How would an abortion seeker get a medical board in the district? And in order to, and if that fetal anomaly has been detected, then she is already, or they are already, the abortion seeker is already in higher gestation limit. So it becomes extremely difficult to set up that medical board. Though a lot of changes have happened, a lot of changes are progressive, but still there is a huge way to go. Moreover, abortion is not decriminalized in India. Decriminalization is key to making it more liberal. It is key to making it more accessible. But, however, laws become progressive. If there is no awareness around it, if the mechanism, say the government mechanism, doesn't kick in to generate awareness, because the government is a huge body, right? I mean, they have a lot of resources, they have a lot of power. So we feel that, at MSI, that a lot needs to be done around awareness. We did a study last year on the new amendments and we wanted to find out what are people's perception around it. And we found that 95% of frontline workers on whom a lot of healthcare and information to the last mile depends, they were not aware about these changes that have happened. Moreover, there were many providers who were not aware about the changes that have happened, the amendments that have happened. So, apart from the layers of stigma and taboo that are constantly there in the community and in the society, then there are these blocks, these roadblocks like lack of awareness that is not letting people understand that a safe abortion is legal in India and where they can get that access. And there are lots of people who are exploiting it and providing abortion seekers abortion at a very expensive price. And imagine a young person who just, like latching on to Gail's experience about a college tour. Imagine a college tour needs a safe abortion and she somehow manages to reach a provider. But the provider starts throwing armed questions to her that, how old are you? Well, the first thing is that if I'm 18, none of your business. The second question, are you married? Again, none of your business. But these are certain things, questions that are posed to the abortion seeker to throw her off. And her experience becomes extremely traumatic. And when we say that, abortion and healthcare, like abortion is healthcare, that is not the perception. That's not how everybody is thinking. And yes, when a person is coming to get an abortion, she's already very traumatized. She's going through thousand emotions. And there you are adding to the hurdles, adding to her emotional trauma, and then you are not making that experience correct for her. So there's a need for rights-based work, there's a need for raising awareness, there's a need for creating a lot of conversations, there's a need to understand that abortion is very much essential, critical care, and we should be providing that. Another thing that I want to say that, we know in our closed circle also, we know someone whom we love has gone through an abortion. So imagine if you don't have that support system, which is the case because of the stigma and taboo that is there, that the support circle is missing for an abortion seeker, and the person has an abortion and never talks about it. So it's extremely complex, but it is extremely layered, and interventions are needed in each and every layer in order to remove these obstacles. So yeah, thank you, Gail.
Thank you so much for that very comprehensive response. My next question is, because there's so many hurdles and so many layers that, like you said, so how do you work around all of that? How do you kind of peel back and try to get to the core of the issue and help abortion seekers get access to that?
So it all needs it needs collective work. Now, one single organization cannot do everything, and that is why we here at MSI India believe very much in building and movement building and not reinventing the wheel. We believe that we shouldn't be duplicating each other's efforts. We should be just building on each other's efforts. So if there's one organization that's doing something with the community to raise awareness, we should not also go and raise awareness in the same community. We should go and speak to other geographies, or we make partners. So our model of work around abortion advocacy is very much based on a partnership model. We partner with organizations, we partner with members, with lawyers, with providers, and we try to build on each other's work, because not everything one organization or one individual can do. And India is a huge country. You need to, have parallel interventions. You need to speak to parallel communities, because otherwise you will see one part of the country has the information, the other part does not.
Perfect. Thank you. I I didn't even think about how the population would even play into how difficult this can be, because the more people that there are, the more groups, the more different ideas and ideologies and thoughts. And India is the most populated country in the world right now. So imagine dealing with billions of people with all different mindsets and how they feel, how they think. So it must be very difficult.
Yes, it's a huge country, very complex country, very old history of patriarchy and misogyny, which is still there. So, most of the laws or most of the legal aspects that come in, or the schemes that come in, they come from a little patriarchal angle, and we cannot deny that, because it's more men in the workforce, so they are thinking from their perspective, and they are coming up with the law. Same with intervention, more men in the workforce. So it's very important to speak to the people before you come up with any intervention, with any action, because many a times what happens that we have noticed is that there are wonderful schemes probably by the government, and there are many wonderful schemes by the government, but it hasn't translated on ground. And why it has not translated is because the communities have not accepted it, because they don't feel that there is a value to it. The scheme has been brought from a very higher level without consulting the community. The participatory approach is missing. So yeah, in India, apart from all the social structural pillars or barriers that's there is also a need that we speak to maximum people, we speak to different kinds of people, we sit with the people to make a program or make any action work for them. Even for the clinics, we can set up a clinic, but if we do not do our due diligence to understand whether that particular geography needs the clinic, not understanding what is the TFR of that community, how many teenagers are there, what's the teenage pregnancy, if we do not do that due diligence, that'll really not work.
I found it really interesting the point that you made about patriarchy, about cultural and history, because it links to the next question, which is that I believe that every one of us has implicit bias, whether we want to have it or not, because we are the product of our upbringing. We are the product of the society that we were brought up in, the social structure, and we know that in many parts of the world, it's a patriarchy world. So even if we didn't want to, we were conditioned into thinking all of these little patriarchy ideas. So because of that, like Simone de Beauvoir said, the most important thing that we have to learn is to unlearn. So I want to ask you about the staff at MSI India. So what are the biases that are prevalent in the staff when you work in these topics, especially when it's so sensitive, and how are they sensitized about that?
So at MSI, we have a lot of policies and processes in check. We try to induct a person. I mean, it's a little bit of a hire, during hire itself. We try to check those processes. We ask for a few perspectives from a person, from a candidate who wants to join us. We want to understand their anti-choice or their pro-choice narrative. If they're anti-choice, what is the narrative that they're coming from? And pro-choice, of course, we understand how pro-choice they are, and we share very real examples to them that they are going to face on a daily basis. We have worked with MSI CAT earlier, so there is a clinical angle to safe abortion. So we create those narratives for them. We share those examples with even the pro-choice candidates and try to find out, what are their inherent biases. Then we try to find out, what are their opinions about gender, and we try to address those right at the beginning. Now, those who have been in the organization, it's not that your opinions cannot change. You are an individual, your opinions and your perceptions can vary. Like today, you may think something, tomorrow, you may have read of something, and you can have a completely different opinion. So we have something from a very global scale. We have something called as value clarification training. So we have this value clarification and aptitude training for all our staff, especially our providers, because it's important to check that there is no provider bias at MSI clinics, because we are saying that that is a safe space for an abortion seeker. So we cannot leave any room for provider bias over there. So those are certain steps that we take.
The VCAT, I remember that now. I've been one of the facilitators, and it's talked about all the time. The VCAT.
Yeah, it really helps you question your inherent biases, your unconscious biases, and it's always good to, corner yourself and take a week out once in a while, because it acts as a refresher to your inherent biases, which you probably are not even aware of, but it comes across probably in actions, or, it's playing in your mind. Or again, like I said, there's so much content these days. Like there's pro choice content, I think there are five times more anti choice content. So young minds are reading it every day, they're consuming that content. So you need to, like it's a young workforce at MSI. It's a good mix of young, seniors, and a lot of other ages. So it's important to do those clarifications. And as an individual, for me, as an advocacy person for safe abortion rights, it's important for me to go through those. Go through those trainings and correct myself, because I also need to understand if I have any unconscious bias.
I think that's so cool because for Ghana, in Ghana, I think one of our major problems is provider bias. Because even just identifying as a girl or a woman, when you go to seek any sort of sexual help, the stigma sometimes it's even in the way they speak to you. You just clamp up. I think even for me that I'm doing this now and I'm saying I'm still not very comfortable that if I am to find myself in a position where I have an unwanted pregnancy, I would want to walk to a hospital or any clinic at all to seek healthcare. I would rather self-manage because, like I mentioned, even if it's not abortion, when you just go to a clinic in Ghana here to seek any sort of sexual health care, the way you are talking to, the attitude, it just puts you off. Like you don't even want to do this anymore. So I think it's very, very important that MSI does this. And as we said, people's opinions can change with time. So the value clarification exercise is amazing because someone can start out as pro-choice and then during their tenure, they can be exposed to so many things that would just make them switch to the other side. So I think they are doing an amazing job. And the next question, we are going back to the people now, away from the providers, because like we mentioned, there's a lot of stigma around abortion and abortion care in India. So we want to know from your perspective as people who work on ground, how do you respond to communities where they are unresponsive to the care that you are trying to provide? And this can be in the case of the elderly people, because sometimes, sorry to say, but the younger the youth are more easy to speak with and try to share your opinions with than older people. Because from my side of the world, if they are trying to explain something to an older person, they are even going to take it as they are being disrespectful. Their word is law, and nothing you can say can change their mind. So in unresponsive communities, how do you sensitize the people in there to be able to give them the care that they need?
It's difficult. At times you have to make repeated conversations in order to have a foot at the door. It's not easy, and it's not just because it's not just in India. It's not just with the old people. It's also with the young people, because there's generational patriarchy. Somehow, even the youngsters believe that they, that they are holier than thou if they are a man or boy. So it's not just a problem to talk to communities which have older generation or a generation who we definitely find it difficult to speak to, but we also see a lot of young people coming with a lot of bias. So our way of work is generally, repeated conversations, asking them to come and visit us, to see our work, making them exposed to a lot of work that we do, speak to our counselors, speak to the frontline workers. So that's something that we do very diligently, is that speak to the frontline workers. Generally, these frontline workers are from the community themselves. So they have more trust in the frontline worker than an international NGO that's coming and telling them that, here is this particular clinic, you come here. So we do not want to do that. So we empower the frontline workers with knowledge and information because we know that they are trusted by the community, and that is why we ensure that let them be our spokespersons. So we work with frontline workers. But yeah, I mean, I completely agree with what you shared about Ghana. It's the same situation in India. It's a very cultural country. We have a lot of respect for our elders, and that's how we are brought up. And stigma and taboo around safe abortion or even sexual education or sexuality is highly prevalent in the country. But it's not a problem with only that generation. It's also a problem with young people. I mean, it can be a little, controversial because we would assume that young people would be more open, but at times our experiences have shown that young people are not often as open as we might assume them to be. However, if you catch them in schools and you train them, you start orienting them on sexual education at schools, they tend to be more open when they are 18 or 19 because they have had, I mean, it's about again that coming to that conversation about content, that you are exposing them to content, you're exposing them to what are their sexual rights, what are their reproductive rights, you are giving them exposure on consent. What is consent? You are empowering them and enabling them to have those conversations within their families. So they tend to be better. But those young adults who haven't had those kind of interventions, many college goers come up with high biases. We have done a lot of vox pops kind of a thing where we went out and we asked the public what you think about safe abortion and abortion in India. And then the third question was obviously whether you know that if safe abortion is legal in India. Many young boys and girls, they said that abortion is a crime. So that bias is generational bias, unfortunately. And there's a lot to do in terms of, mitigating that.
I think you are so right in terms of talking about social media content because I have seen some experience online where there was this one particular video that I saw where this person created a brand new TikTok account and then they started watching a few right wing content, a few conservative content, and then within just 1 hour, that was all they were shown, and it shows that the rabbit hole, you can go down the rabbit hole very very quickly if you're not careful, especially if you're young and you don't have any foundation understanding to begin with because no one has ever talked to you about that, so you don't even have the foundation understanding to know that no, this is wrong and this is right. So you are young, impressionable, and you see all this content online, and then before you know it, that's all that you see and that's all that becomes your reality. You're stuck in this echo chamber, and then it's going to be very difficult to get out of.
Completely.
Thank you both for sharing. This has been a very insightful and informative live stream. We have just a few minutes left. I think one thing I heard from you, Devandana, is that build solidarity. It's important that even as an organization, you don't work on your own. You try and collaborate with other organizations so that you can reach a wider audience and then be able to do more, especially in a country as populated as India. So I want to hear from you for anybody listening or anybody who watch this on YouTube later. If they are looking to set out to help to build solidarity, what are some advice or pointers you have for them?
See, solidarity and network is the only way to reach a very wider population, as you have mentioned. I mean, there's no two way about it. But a very important thing in any partnership is that you remain humble. You understand the other organization or the other person and try to fit in each other's work. I know in an organizational mandate, it so happens that each organization has their own mandate. We have this KRA, we have this donor mandate, our funder wants this. You need to have a common plan out of whatever is your larger umbrella. If you are working on one unified thing, for example, again, that MTP Amendment Act, one common agenda needs to be there. If it is decriminalizing abortion, that one common agenda that everyone works towards while they are working in the larger mandate that fits into their organizational strategy, 25 strategy, 2030 strategy. We all know that, strategies are there, and, we have to meet those strategies. But in partnerships, it's key that there's mutual respect, that there is inclusion. Try to seek diverse partners, because the more you break out from your echo chamber, the better it is. You're going to reach a wider set of people. You'll be able to have a better impact, and thereby, lesser biases, better access. Yeah, life would be easier.
Absolutely.
Thank you so much for that. Just to end our lives again, our time is almost up. We only have about 4 minutes. For anybody who wants to find MSI India or Safe to Choose on social media, can you share your handles with them? And Devanjana, go first and then Kat.
Thank you so much, Gail and Kath, for this opportunity. So we at MSI India, we are on Twitter at Rights Pratikya, on LinkedIn at Foundation for Reproductive Health Services India, at Instagram at Rights Pratikya. So shout out to us. We also have our Ali bot from our partner here on our website. Please reach out. Please speak to us, and get in touch. Let us have a conversation.
Perfect. And if you are looking for abortion information or you are looking for counseling, you can go to Safe to Choose. I am pointing in the wrong direction. Right here, so Safe to Choose. We are available on Instagram, on Facebook, on TikTok, on X, on YouTube. And you can also go to our website at safetochoose.org. Again, we have counselors who speak multiple languages, even Hindi. So if you are looking for a counselor, someone to talk to about abortion, about the process, or about how to use abortion pill, you bought some pills and you don't know how to use that, you can contact our counselors. You can go to the website to watch a protocol. And if you are watching this live on Twitch, don't forget to follow us. We also have a Discord channel, so you can also join our Discord channel. Yeah, I think that's it. So how to use abortion pill.
Thank you so
No,
much. Okay, sorry, April, please.
okay, no worries. So if you are looking for comprehensive and accurate information on how to use the abortion pill, you can find us on Instagram, on Twitter, on Facebook, and TikTok at HTU Abortion Pill, and Facebook How to Use Abortion Pill. You can also go to our website to interact with Ali or text Ali on Facebook or via our WhatsApp. When you go to our Instagram page, you see the link to start a chat with Ali. And also don't forget that we have a series that will help you self-manage your abortion at home very comfortably. In this month, we are also rolling out some other videos with Dr. Tudar Bondes. Some of the topics we are addressing is abortion and mental health, how to talk about abortion without stigma, of course, and so much more information you'll find on our social media. So do well to follow us and just stay tuned on our Twitch, because we'll be doing this very often, like acted twice every month.
Yeah.
And thank you for joining us, Evangelina.
Thank you for having me. It has been a wonderful evening for me. It's my side of the country. So, thank you so much for having me again, and thank you for this extremely inspiring conversation.
Thank you. Thank you both for joining this live stream, and it's always so exciting to be talking about this, especially since International Safe Abortion Day is so close, and it's such an important day for all of us working in the abortion field. As you heard, my dogs were also very excited about this conversation, that they were barking all the time. So sorry about that. But yes, thank you for joining, and don't forget to follow us. And as I say all the time that if you're looking for information about anything, don't just check one source. So go to MSI India website, go to Safe to Choose, and go to How to Use Abortion Pills to verify your information. So open all three websites. So thank you so much, and Devanjana, I hope that we will have conversations like this in the future, and I hope that maybe someday you'll join us again for another wonderful topic. All right, so thank
Absolutely.
you.
No, I was saying absolutely, very much, 100%.
Perfect. Thank you so much, everyone, for watching, and we will see you in the next live stream. Bye.